We look back with pride at the building blocks we've put in place to ensure decent healthcare for all. Such has led to increased life expectancy, the reduction in child mortality, and an overall improvement in the effectiveness of the health system. But it raises a concern when 42.5 million South Africans rely on public health care because it's outside their financial means, whereas only 8.7 million can actually afford private treatment, according to the Business Day. Well, joining us now, let's chat a little bit more about this and speak about some of the concerns around medical aid costs is SAMA chairperson and orthopedic surgeon, Dr. Mzukisi Grootboom. Dr. Grootboom, thank you for being with us, and it's wonderful to have you here on Morning Live.
Good morning. Thanks for having me.
I mean, it's just such a frightening picture if one has to imagine a scale of the amount of people that are using the public healthcare system and those very, very few fortunate ones that are able to use the private healthcare system. Medical care costs are very, very expensive. One can only gather that.
Yes, it is true, and the biggest problem, of course, is accessibility and affordability of being able to be covered by the various funding schemes that are available in the country. Now, there's a figure which is always branded around. There's about only 8 million that are covered by private healthcare, but the figure is slightly bigger, but probably a moot point. If you look at the recent household survey by Stats SA, is that the figure is actually slightly more than that. It ranges between 14 and 16 million. So the other 7 million are out-of-pocket expenses that people actually do take out of their own pocket to fund their health care.
Yeah.
And one of the interesting trends coming out of the same study is that there has been an increasing trend of people as a first choice actually seeking health in the public sector. And to me, it's an indication that the services are being spread out to some areas which were never been serviced, and particularly in the private sector. And certainly the push by the national minister to get the primary healthcare services to those communities is beginning to bear fruit.
Yeah. Let's just go back and have a look at medical aid costs and schemes. Why are they so expensive? Where does the cost lie?
We actually would want to advance the thesis that part of the costs relate to the usage, the demand for healthcare services. And if you look at the various factors, one of them being the burden of disease, an aging population, an increase in the technology that we have over the last few years. And certainly the factor of the demand for the services might be a key factor which nobody has addressed and nobody is able to tell us how that affects the current increase. Because if you look at the payout between 2011 and 2013, there's almost been a big jump from 89 billion to 102 billion that has been paid out in 2012 alone. So it's a huge amount that people have paid out. And those services, again, one of the key factors might be related to the fact that that is us as medical practitioners, particularly the schemes themselves, have failed to educate people to realize that a medical aid card and a medical aid benefit is an insurance cover when you are sick. You don't use it because you have got access to that amount of money in your medical aid card. And it's very, very important that you don't go because you feel your card at the beginning of the year has got enough money, therefore you must see a medical doctor. You must go there because there is a necessity either for preventative care or for curative care.
Yeah. You know, the thing is, and the reality is the average South African cannot even think about taking out medical aid, private medical aid, because it is so expensive, as we've been discussing. Are there any affordable options available when choosing a medical aid product to suit an individual's pocket?
There are various low options that are available throughout the industry. And it's very important that the general public is actually made aware that there are affordable packages. They need to go to their brokers and get good advice about what is available out there in the market. And really, my advice is that a medical aid should be used purely when you are sick, not because you want to do other things with it and you feel that you've got some entitlement to take your card and use it for other things that are other than medical.
Yeah. All right. Well, those are the advice that we're getting from Dr. Grootboom. Just talking about the fact, and I think it has become something where medical aid, it's no longer a luxury, but it's an investment in your future. Would you agree with the sentiment?
Absolutely, it's an investment, because it's like any insurance, Leanne, is that you want to use this benefit in case there's a catastrophe. One of the worst things is that when you actually need it, you've been involved in a major accident or you're very sick, you find that your benefits have been exhausted. That's the worst thing that can happen to anybody.
Yeah.
And it's very, very important in this day and age that people inform themselves what benefits they have and when they can use their medical aid card, because that to me is key to the whole debate.
All right, let's leave it there for this morning. A conversation that I know we could keep going with Dr. Mzukisi Grootboom, the chair of SAMA, and he's also an orthopaedic surgeon, talking to us from our Durban studios about the importance of medical aids and the high costs associated therewith.